Good day, everyone. Our lecture for today would be about dyslipidemia. The definition of dyslipidemia is defined as the imbalance of lipids such as cholesterol, low-density lipoprotein cholesterol, triglycerides, and high-density lipoprotein. Common risk factors for this results from diet, tobacco exposure, or genetic. All of this can lead to cardiovascular disease with severe complications. There are different forms of dyslipidemia. Your laboratory results will show that you have different levels of LDL, HDL, and triglyceride. One form would be you have elevated LDL or bad cholesterol. Also, you may also have low levels of HDL or good cholesterol. Even elevated levels of triglyceride is also considered as dyslipidemia. Total cholesterol is defined as the level of your LDL and triglyceride. If this is high, you may also have dyslipidemia. Lipids or fats are building blocks of life and provide energy to cells. Lipids include LDL cholesterol, which is considered bad because it can cause plaques to form in the blood vessels. HDL cholesterol, which is regarded as good because it can help to remove LDL from the blood. Triglycerides, which develop when calories are not burned right away and are stored in fat cells. Healthy blood lipid levels naturally vary from person to person. However, people with high levels of LDL and triglycerides or very low HDL levels tend to have a higher risk of developing atherosclerosis. Atherosclerosis develops when hard, fatty deposits called plaques accumulate in blood vessels, making it difficult for blood to flow. Over time, these plaques can build up and cause major circulation problems such as heart attacks and strokes. Unless it is severe, most people with dyslipidemia are unaware that they have it. A doctor will usually diagnose dyslipidemia during a routine blood test or a test for another condition. Severe or untreated dyslipidemia can lead to other conditions, including coronary artery disease and peripheral artery disease. Symptoms of coronary artery disease and peripheral artery disease. Both coronary and peripheral artery disease can cause serious health complications, including heart attacks and strokes. Common symptoms of these conditions include leg pain, especially when walking or standing, chest pain, tightness or pressure in the chest, and shortness of breath, pain, tightness and pressure in the neck, jaw, shoulders, and back, indigestion and heartburn, sleep problems and daytime exhaustion, dizziness, heart palpitations, cold sweats, vomiting and nausea, swelling in the legs, ankles, feet, stomach, and veins of the neck, fainting. So these symptoms may get worse with activity or stress and get better when a person rests. Talk with a doctor about chest pain, especially any of the above symptoms may accompany it. Anyone who experiences severe chest pain, dizziness, and fainting or problems breathing should seek emergency care. Several factors are known to increase the chances of developing dyslipidemia and related conditions. These risk factors include obesity and sedentary lifestyle, alcohol and tobacco use, use of illegal or illicit drugs, sexually transmitted infections, type 2 diabetes, hypothyroidism, chronic kidney or liver conditions, digestive conditions, a diet rich in saturated and trans fats, a parent or grandparent with dyslipidemia, older age, and female sex, whereas women tend to experience higher LDL levels after menopause. Treatment for dyslipidemia will usually involve taking medication. A doctor will usually focus on lowering a person's level of triglycerides and LDL. However, treatment can vary depending on the underlying cause of dyslipidemia and how severe it is. Doctors may prescribe one or more lipid-modifying medications for people with very high total cholesterol levels of at least 200 milligrams per deciliter of blood. High cholesterol is usually treated with statins, which interfere with the production of cholesterol in the liver. If statins fail, a doctor may recommend additional medications including ezetimibe, niacin, fibrates, bile acid sequestrants, evolocumab and alirocumab, lamivudine, and mipomersen. Statins are a class of medications used to lower high cholesterol and reduce the risk of heart attack and stroke. Statin doses are often categorized as low, moderate, and high intensity. Your cholesterol goals, medical conditions, and other factors may determine which statin is right for you. Some lifestyle changes and supplements can help to encourage healthy blood lipid levels. Natural treatments include reducing the consumption of unhealthy fats such as those found in red meats, full-fat dairy products, refined carbohydrates, chocolates, chips, and fried foods. Exercising regularly. Maintaining a healthy body weight by losing weight if necessary. Reducing or avoiding alcohol consumption. Quitting smoking and other use of tobacco products. Avoiding sitting for long periods of time. Increasing consumption of healthy polyunsaturated fats such as those found in nuts, seeds, legumes, fish, whole grains, and olive oil. Taking omega-3 oil either as liquid or in capsules. Eating plenty of dietary fiber from whole fruits, vegetables, and whole grain. Getting at least 6 to 8 hours of sleep at night, and drinking plenty of water. Tips for success. You need to eat smart. Eat a healthy variety of vegetables and fruits and limit your sugary foods and drinks and processed foods. Take medications as directed. Your healthcare professional may prescribe statins or other medications to control your cholesterol levels. Move more. Physical activity helps improve cholesterol levels. Know your fats. The fats that you eat can affect your cholesterol levels, so replace saturated with unsaturated fats. And lastly, no nicotine. Smoking lowers good HDL cholesterol. It also raises your risk of heart disease. People with minor dyslipidemia usually have no symptoms. They can often manage or resolve the condition by making lifestyle adjustments. People with dyslipidemia should contact a doctor if they experience symptoms relating to the heart or circulation, including chest pain or tightness, dizziness, heart palpitations, exhaustion, swelling of the ankles and feet, trouble breathing, cold sweats, and nausea and heartburn. People who have severe dyslipidemia, especially those with other medical conditions, may need to manage their blood lipid levels with medication in addition to making lifestyle changes. To sum it all up, minor dyslipidemia can be managed through lifestyle changes. So here is a quote for everyone. You only run when chased? Well, higher blood pressure, higher cholesterol, increased body weight, and a shorter lifespan are all chasing you. Maybe you should start running before they catch up. And I think for everyone, we need to start exercising before dyslipidemia catches up with us. Thank you and have a good day.